Isabella from the UK and Nyosta from Kenya. They're almost the same age, but their chances of a healthy future are very different. That's because Nyosta will not get all the essential childhood vaccinations available to babies like Isabella in richer countries.
Today, children in developing nations are 10 times more likely to die from a vaccine-preventable disease than they are in the wealthy nations.
There's a number of vaccines that we use in the West that really should be used in the poorest parts of the world, but for far too long those have been denied on the basis of cost.
There is no other tool in public health more effective than vaccines.
Each year, 2 to 3 million children die needlessly from diseases which could be prevented through routine vaccination. Three-month-old Winnie has severe pneumococcal pneumonia. A simple vaccine could have prevented this illness.
I think I'll describe the feeling that I have as being helpless. All you can do is give them the antibiotics and wait for them to work and see the children day after day. And it's not good. It's not good.
A new vaccine against pneumococcal disease is available in the West. GAVI is committed to rapidly getting new vaccines to children in the poorest countries.
I'd be very glad if we did have a vaccine against pneumococcal disease. Less children would suffer.
Vaccines are the most powerful medical weapon we have against disease. Smallpox has been eradicated, polio eliminated from most of the world. New and existing vaccines could prevent a quarter of all child deaths in developing countries. These include protection against pneumonia, meningitis and diarrhea.
Historically, it's been estimated that there's a 20-year gap between when new vaccines are introduced into wealthy nations and when they're made available in developing countries.
Together, the GAVI Alliance has already begun reducing that gap. Public and private partners such as UNICEF, the World Health Organization, the World Bank and the Gates Foundation are working together to ensure that vaccines reach every child, everywhere. Delivering vaccines to the remotest parts of the world is a huge challenge. Biological products have to be kept cold, which is difficult on long, hot journeys. But this is not an insurmountable task.
Products such as Coca-Cola and cigarettes can get out there, and so, I think vaccines should be able to as well.
It's one of those areas in which you save lives, and it's, compared with many other fields, is so cheap.
An affordable and sustainable supply of vaccine is needed for the world's children. GAVI is using innovative new financing tools to raise predictable funds over the long term. The security of this funding supports the long-term commitments countries are making in their children's health. Vaccines are a wise investment. By accelerating the introduction of vaccines, GAVI plans to save lives, bolster health systems, and build stronger economies.
Because if we have instruments that can avoid disease, avoid death, and contribute to economic development, which in turn will get people out of poverty, it would be totally immoral if the world leaders from all countries, don't take action, and the action should be taken today.
I think vaccinations are some of the best investments in health and progress of any nation. They're cost-effective, they're relatively easy, they last. I think the right to vaccination and protection from preventable disease is a right for every child and should be available to every child, regardless of where they are born.